Good evening, everyone. My name is Sharon Moreno, and I'm a family nurse practitioner. I practice locally in the Rio Grande Valley and see patients via telemedicine all over the great state of Texas. Today, our topic is going to be stroke. So we're going to talk about strokes. This is a topic that's rather common in the United States. We'll talk about statistics shortly. As usual, we'll get started with our legal disclaimer. So in the meantime, we post that and I give you the opportunity to read that. Please post your what do you call it? Your topics of choice. I'd love to cater to whatever subjects you're interested in. If you don't have any suggestions, no worry. I'll continue to create topics. But I'd love to cater to whatever suggestions you have, if you have those. We have our first comment. Hi, Diola, how are you? Thank you for being a faithful listener. And again, as always, please use me as a community resource. You can get a hold of me a variety of ways. The first way is via text message. 956-640-6963 is my cell phone. Text me with questions, comments, or concerns. Don't call me. If you call, I won't answer, but text me and I'll respond promptly. You can also get a hold of me via my Facebook at Sharon Moreno via Messenger. I also do have a website, goldrushhousesolutions.com. I do have a messaging system there. You can also message me through that area as well for a variety of services. I offer home visits. I offer telemedicine services. I offer weight loss with the use of prescription pills, vitamin B12 injections, steroid joint injections for pain, antibiotic injections and prescriptions, depression medications, anxiety medications, thyroid medications, high blood pressure medications, diabetic medications, you name it, and I offer it. At this time, I am offering free TENS machines. I did post that on my Facebook page. So if you are interested in a free TENS machine, and these are little devices that offer electric shocks for pain, please send me a message and I will give you guidance as to how you can go about picking up your free TENS machine. Alrighty, guys, as I mentioned, our topic of choice today is going to be stroke. And this is a rather important topic because this is an urgent issue. So one thing that's really important is that if you or someone that you know has symptoms of a stroke, this is an urgent situation where 911 needs to be called. So let's get started. As you know me, I love statistics. So it gives us a bird's eye view of how important this particular topic is. So the fifth leading cause of death in the United States has to do with strokes. The fifth leading cause. So that's pretty devastating. Approximately 80% of strokes are preventable. That's also devastating, 80%. So we're going to talk about some things that we possibly can do to prevent having a stroke. Every 40 seconds, someone in the United States has a stroke, while every 3 minutes and 14 seconds, someone dies of a stroke. That's pretty significant considering that approximately 80% of strokes are preventable. So if every 3 minutes and 14 seconds someone dies of a stroke, what if 80% of these could have been prevented? You know, that's really important. So let's talk about some things that perhaps can prevent someone's death. And we have Clarissa here. Hi, Clarissa. How are you doing? Thank you for joining us today. I know that's been a couple of shows that you've been joining us, so I appreciate you. So let's get right into it. Let's talk a little bit about overview. As I mentioned, strokes, these are medical emergencies. So We're going to talk a little bit about symptoms as we continue with the presentation. If these are some symptoms that you identify, the issue is that even if you think that it possibly could be a stroke, don't second guess it. Call 911, get to the hospital right away. Uh, the issues with stroke is either it prevents brain tissue from getting oxygen and nutrients, or pressure is increased on brain cells and damages them. So either one of these two things are happening. Again, we have either brain tissue that's prevented from getting oxygen and nutrients, or pressure is occurring on the brain cells, which is damaging them. Getting emergency medical help quickly can reduce brain damage and other stroke complications. Pay attention to the time the symptoms began, as some treatments are most effective when given soon after the stroke began. So that's really important, because once you get to the emergency room, many times they'll ask you, when did the symptoms begin, or when did they, when was the onset? Because there's a certain time frame for certain treatments. Once you run out of that, window of opportunity, then one or two things may happen. Either you may no longer be a candidate, or you may not. The treatment may not be as effective anymore. And we have Juliana. Hi, Juliana. How are you? Thank you for joining us today. We're talking about strokes today. This is a really important topic. It's an urgent topic. So let's talk about some symptoms. Let's talk about some things that if you see or identify, when you should call 911 or rush the patient to the hospital. So what if we see someone with trouble speaking and or understanding what others are saying? This could be a person having a stroke, may be confused, slur words, or may not be able to understand speech. So this is what is meant by someone having trouble speaking and or understanding what the other person is saying. Again, they may be confused. So someone who normally isn't confused may all of a sudden become confused. They may be slurring their words, or they may not be able to understand what is being conveyed to them. You may be giving them a directive, asking them to do something, and they may not be able to follow that directive or those commands. They may be complaining of a headache, and this may be a sudden severe headache that has vomiting, dizziness, and a change of consciousness. Um, Now, it can be a severe headache. It can be with or without vomiting. It can be with or without dizziness. It can be a with or without a change of consciousness. But the key point here is that it usually is quite sudden, and it usually is quite severe. Even the individual may have trouble walking. They may stumble, or they may lose their balance or coordination. And it usually looks like something in the picture here, for the reason being that they usually have weakness or paralysis to one side. It's usually either to the leg, the arm, or both sides, or one complete side. Something that we have to look for when we're looking for potential symptoms is what we know as FAST, F-A-S-T. We would look at the face, ask the person to smile. Does one side of the face droop? Do you notice that their mouth is crooked? Are they drooling? Are they mumbling? Are they slurring their speech? Does their mouth not look correct to you? The A is for arms. You would ask them to hold their arms directly in front of them like this. You know, does one arm drift downward, or is one arm unable to rise? So you would ask them to raise up their arm, and all of a sudden they're able to raise up one arm only and not the other, or you ask them to raise up both arms and now it's uneven, or they start like this, but they can't hold both of them up and one drifts down, then that would be a positive test. Again, now the issue with this test is it has to be something that's new. It can't be something that's old. This has to be a new onset. We want to look at their speech. We want to ask the person to repeat a simple phrase. Is the person's speech slurred or different from usual? Again, they have something different within their face, whether it be their eye drooping, whether their mouth drooping. If their mouth is drooping, then their speech would be affected. And the T is for time. If you see any of these signs, again, call 911 right away. That's important, and you want to know the time. Again, once you get to the emergency room, they will ask you what was the onset of these symptoms. When did you notice, or when was the complaint that these particular symptoms occurred? So there are different kinds of strokes. And let's talk about these different kinds of strokes. Obviously, the different kind of strokes warrants a different kind of treatment. So the first kind of stroke is ischemic stroke. And this is the most common type of stroke. So among the variety of stroke, this is the one that happens the majority of the times. And this happens when the brain's blood vessels become narrow or blocking, causing reduced blood flow. And if you look on the picture to the right side, you can see what a blocked artery looks like. On the bottom right corner, you see a normal artery where there's absolutely no blockage to the area. And on the top, you can see what appears to be plaque formation or cholesterol formation um, that accumulates over time, narrowing the artery, thus now narrowing the artery. And so now reducing the passage for the arteries. So now the blood is not as readily available to pass through that area, and ultimately this narrowed area can become completely blocked, and then that's when we have the ischemic stroke. So the area can become blocked or narrowed. Blocked or narrowed blood vessels can be caused by fatty deposits, as we just talked about, blood clots, or other debris that travel through the bloodstream, most often from the heart. So again, this is not the blocked artery necessarily isn't the only reason why we can have an ischemic stroke, but we can have blood clots that can cause this, or other debris, from surgeries and things of that nature that can cause these blockages to the brain. Occurs when fatty deposits, again, blood clots, or other debris become lodged in the blood vessels of the brain. So again, the issue is that the brain becomes anoxic. In other words, it's not getting the oxygen and the nutrients that it needs, and it's basically crying out for help. The second type of stroke is the hemorrhagic stroke. And this is quite the opposite. So this occurs when a blood vessel in the brain leaks or ruptures. And in the picture here, you can see that particular blood vessel, instead of there being an occlusion, now this is a rupture. So you actually have a bleed in the brain. Now, what sort of factors lead to this hemorrhagic stroke? You have things like uncontrolled blood pressure, so high blood pressure. You have overtreatment with blood thinners like aspirin, Plavix, Eliquis, Xarelto, those particular blood thinners. You have weak blood vessel walls like an aneurysm. You have a head trauma, such as from an accident. You can have a motor vehicle accident. You can have a fall. Um, some sort of head trauma, someone gets hit in the head with some sort of object, and causes a rupture to an artery in that particular area. So again, the first type of stroke is ischemic stroke, where now we have a lack of circulation. And now you have a hemorrhagic stroke, where you have an overabundance of circulation, if you will. You have a rupture. You have just an overabundance of blood flow to the area. The third type of stroke is what we know as transient ischemic attack. And this is sort of a temporary period of symptoms like those of a stroke, but doesn't cause permanent damage. So this, a lot of times, this is kind of known as a pre-stroke or a mini stroke. And what this is essentially it has the symptoms of an ischemic stroke, exactly the same symptoms of the ischemic stroke, but the only difference is it doesn't cause any long-term sequela or disabilities. It's caused by a temporary decrease in blood supply to part of the brain for as little as 5 minutes. And you can have symptoms like weakness or slurred speech or anything on the face, arms, speech, etc. But this doesn't occur for past 24 hours. It resolves within the 24 hours. And again, we need to seek emergency care, even if you think you've had a TIA or the transient ischemic attack, because obviously we don't know if the symptomatology is going to is going to recover or resolve over the next 24 hours or not, that we have no way of telling this. And so it's important that we seek treatment, because if it doesn't resolve in the next 24 hours and it goes past the 24 hours, then obviously you've missed the window of treatment. Um, and that then you have the likelihood of better outcomes worsens. So what are some risk factors? That's a good question. What are some things that would place us at higher risk for having a stroke? Obesity. I'm not sure I've gone over any particular health related topic where a risk factor hasn't been obesity, right? Um, if you're overweight, it tends to be a risk factor for the majority of health related issues. It's just kind of the way things are. Physical inactivity is another one. If people aren't moving around, I don't expect people to go to the gym, but there has to be some sort of movement, whether it's sweeping your floor or gardening. Uh, but those steps have to come in. People have to get moving. Heavier binge drinking. So alcoholic intake is one of those areas as well. Illicit drug usage. High blood pressure is another one of those areas. Obviously, if blood pressure is high, then your heart has to pound heavier to circulate blood, and again weakens those arterial and vessel walls, causing the likelihood of weakness and potential ruptures. High cholesterol. What happens when we have high cholesterol? The issues with plaque formation, the narrowing of the arterial walls, and again, the likelihood of ischemic attacks, right? Cigarette smoking, we increase high blood pressure as well. Diabetes, again, all these sorts of illnesses are sort of all tied in. So, when we have obesity and physical inactivity and cigarette smoking, then it tends to lead to things like diabetes, high cholesterol, high blood pressure. So we can control weight gain and, physical activity, then the likelihood of us having strokes, high blood pressure, high cholesterol, and diabetes is reduced. So, there are great reasons as to control your weight, because it doesn't only help you with one thing, it helps you with multiple things. So, that's again, many reasons. What are other risk factors? Obstructive sleep apnea, again, another thing related to weight. This is where our body, when we sleep at night, stops breathing for a few seconds on and off throughout the night. This can create an enlarged heart. And when we have an enlarged heart, then our heart doesn't tend to work as well anymore. And we can have symptoms like shortness of breath, cough, swelling to extremities, and our heart just doesn't pump as well anymore. So we have ultimately things like shortness of breath at rest and shortness of breath just existing. Heart failure, heart defects, heart infection, atrial fibrillation, family history of stroke, age 55 or older, African American or Hispanic races, being of male sex, taking hormone therapies that contain estrogen. Why? Because there's higher likelihood of DVT or deep vein thrombosis. They tend to create, you know, blood clots. I remember some time ago the patch for birth control was quite common, and they put out a big risk on that. I believe it was it Ortho Ever? Can't remember the name of the patch particularly. I can't remember if it's Ortho Ever. But I believe it was a quite popular patch, and then they put out a big risk that if you were a smoker, that it was essentially contraindicated, and if you were not a smoker, that you really need to watch out because there was a big risk for blood clots because of the estrogen in those particular hormone therapy for birth control. Now, let's say you do have uh, a stroke, as a result, what are some complications? So we have things like paralysis. Now you'll end up with weakness or being paralyzed to one half of the body. That's usually how we see it, how we see this. Trouble speaking or swallowing. Now we have risk for choking, food going into the lungs or fluids going into the lungs, thus causing pneumonias, memory loss, or trouble thinking. Thoughts aren't necessarily complete. Trouble controlling emotions or depression. So we see that people have history of TIAs, ischemic or the hemorrhagic strokes now have issues with, now they're more irritable. Now they suffer more from depression. They have issues like pain, numbness, and tingling to the areas that were affected by stroke. They have issues with self-care, and their behavior seems to be a bit more withdrawn. Their affect is rather flat, where they seem to congregate less with people, tend to be more, want to be more alone and, without being around people. Because again, these are the strokes affect your brain. This is a place where your brain was without oxygen for X amount of time. So this is a neurological issue. Let's look a little bit about prevention. Again, these are things, remember, 80% of the strokes can be prevented. So let's look at what we can do to help prevent strokes. So blood pressure control, this is one of the most important things you can do. I have seen people extremely young have strokes because of blood pressures control. They were smokers. And again, smoking, the nicotine, and not only smokers, I should say, it's nicotine use. So it can be those, I'm trying to remember the name of those things that you put in the side of your mouth. But basically, any form of nicotine, it can be in the form of vapes, it can be in the form of smokes, um, and those, I can't remember the name of these things, but they're so common. People put them in the side of in the buccal area. But any form of nicotine can increase blood pressure. People are using nicotine, disregarding blood pressure. Blood pressure needs to be in the 120s. That's the goal, for the reason being that, if anxiety happens, something were to happen, our body needs to be able to compensate for these sort of things. The last thing we want is our blood pressure to run 130s, 140s, and then we run anxious and our blood pressure goes over the 140s, and now it's abnormal, and this affects our kidneys, our eye vessels, our again kidney vessels, circulation, where we have issues with our legs, basically any appendage. So again, blood pressure is one of the most important things we can do. We really need to have that blood pressure control extremely tight. Lower the amount of cholesterol and saturated fat in your diet. This may reduce buildup in the arteries. We talked about that. One of the biggest issues with the ischemic stroke, which is the most common stroke that occurs, is the fact that plaque starts to build up, and now we have a narrowing of the arteries, which is one of the main issues that the stroke happens. We talked about cigarette smoking, and well, again, I keep saying cigarette smoking, but it's not cigarette smoking solely. It's the use of nicotine. And not only just the use of nicotine specifically, but even secondhand smoke, because you are getting that nicotine secondhand as well. And a lot of times it's worse as a secondhand inhaler. Managing diabetes, again, that affects circulation. When circulation is compromised, then we have narrowing of arteries and vessels. So again, when we have compromise in circulation, then we have less room for blood to move around, thus reducing the space for blood to get to the brain. What other things can we possibly do? Maintain a healthy weight. Again, the obesity keeps popping up where, we need to be in a better place regarding weight. Eat a diet rich in fruits and vegetables. This all goes back to, being at a better weight. Exercise regularly. And by exercise, I mean just get moving. Get a baseline amount of steps. So let's say, the recommended amount of steps are 10,000 a day, which amounts to about 3,000, amounts to about 3 miles a day. But let's say you get a baseline. So let's say you're doing about 500 steps a day, right? Look at your steps daily for 7 days. And let's say it's about 500 a day. So what you want to do is the following week, instead of doing 500 a day, slowly increase that and say, you know what? I'm going to do 600 today. So do 600 on Monday, 600 on Tuesday, 600 on Wednesday, 600 on Thursday, 600 on Friday, and 600 on Sunday. And how would we do that? Again, you can do things by parking your car farther when you get to the grocery store. Um, looking at ways of, when you're at work, how can I be more active? For example, if you're a teacher, instead of sitting at your desk while your students are taking a test, walk in between the desk while they're taking their test and get the steps like that. Instead of taking elevators while you vacation, use only stairs. When I go see, I don't take any stairs whatsoever. I mean, any elevators whatsoever, unless simply the stairs are not available. But when I visit the tallest building in Brownsville, I'm going to floor 8 or 9. Guess what? I'm walking 8 or 9 flights of stairs. And initially I was huffing and puffing, and now I don't huff or puff anymore because I'm used to doing that. So your body will get used to doing those steps, and do it as tolerated. You start, you can't do 9 stairs, obviously, but start 1 or 2 and stop, rest, and then go up another 1 or 2, stop and rest, and go up another 1 or 2, stop and rest. That's basically how you do it. So week 2, you're at, 600 a day, and increase as you tolerate. Maybe week 3 or 4, then say, okay, I'm going to do 700 a day. And then week 5 or 6, 800 a day, and just continuously progress to more and more until you're comfortable. Again, drink alcohol in moderation or prevent it. I don't partake in bad habits, so I don't drink or smoke or use drugs, illicit drugs. Treat obstructive sleep apnea. Again, this is an issue where your heart stops beating. I'm sorry, you stop breathing for a few seconds on and off throughout the night. This ultimately weakens your heart. And so we need to ultimately treat that because your heart's going to get tired. And so we need to compensate. We need to help that with a CPAP machine. Refrain from illicit drugs. All of these create issues, especially if they're intravenous use with dirty needles and things of that nature. And that's essentially that, So remember, guys, the issue here is looking at ways to prevent strokes. If we know what we can do to prevent the stroke, then we can definitely work to make those changes, because as we remember, I'm going to go back to our statistics. As we remember, 1, it's the 5th leading cause of death in the United States. And 2, approximately 80% of the strokes are preventable. So what this tells us is that out of all these people who are having strokes, out of all these people who are having strokes, 80% of those could have been prevented. So we need to make changes aggressively to help prevent these strokes, because they do have devastating, life altering changes. I work a whole bunch of patients have had strokes, young and elderly, and it really is a tough place, especially once you are unable to eat like you used to. Diets modified, so now you can eat certain things, and even as easy as starting to choke on water. You have to thicken liquids. Your speech isn't clear. Now people are extremely frustrated because they can't convey their needs. They're no longer independent. They're having to depend on someone else to have their needs met, get around, even very basic things as to, perhaps be fed or, comb their hair, um, and now, as a matter of fact, once you have the diagnosis of stroke, once you have one stroke, the likelihood of you having another stroke is significantly higher. And so the issue becomes now we have to aggressively try to prevent a second stroke, because that can be devastating. And so guess what? Now you're going to be on a handful of medications. And so now not only are you debilitated physically, now you're going to be stuck on a whole bunch of medications. If it was an ischemic stroke, things like blood thinners, multiple blood pressure medications, um, and things to try to help, cholesterol medications. And remember, all of these medications not only are a multitude of medications, but they have a variety of side effects. Things like statin medications. We have to watch your liver to look and ensure that your liver now is not becoming toxic. They also can create a lot of muscle and bone related pains. Blood pressure medications, for the most part, usually end up being on multiple. They can create uh, side effects like feeling tired, low heart rates, feeling weak, feeling tired, dizzy, put you on blood thinner pills, where you're in a place where you have bruising all over your body. If you bump yourself, uh, again, a lot of bruising, higher risk for bleeds. So there's just, again, a lot of devastating sequela related from a stroke. And the goal now is not being proactive. Now it's being reactive to try to help prevent, a second or third stroke. And that's really the issue. If you survive the first one, the likelihood of surviving a second or third one, is extremely tough. And so again, the take from here is, if you experience any of the symptoms mentioned, things like trouble speaking, or understanding what one is stating, headaches, trouble walking, and really the thing to remember is fast, the drooping of the eye, the crooked mouth, the drooping of the arms, weakness of the arms, the difference in speech, uh, then these particular symptoms, you want to call 911 right away and note the time where the onset started, and get the patient to seek treatment right away. All right, guys, that's essentially that for my presentation regarding strokes. I'm open to questions if you have that. Again, I have my flyer up for services. I want to remind you that if you want a free TENS machine, I'm currently offering those absolutely free, no financial cost to you. Just send me a message via Facebook under Sharon Moreno, or you can send me a text at 956-640-6963. You need to be able to pick up the TENS machine. I'm not going to deliver. and I'm not going to mail to you. You need to be able to pick up. I do have about 50 or so. So please, if you have family or friends that are interested for in a TENS machine for pain, then it's a first come first serve basis. Then message me or text me. I also offer a bunch of other services, either via telemedicine or home visit. I offer weight loss with the use of prescription pills. We talked about being in a place where obesity causes a lot of health related problems. In my weight loss program, there's no need to sit in office and wait hours. My program is done via telemedicine. So I respect your time always. Again, just text me. Don't call me, but text me. Let me know what program you're interested in. I'll respond to you. But I do things like weight loss with the use of prescription medication. I do a medical consult first. I need to know your past medical history, what type of medications you take, um, what type of foods are you doing, what kind of activity are you doing, et cetera, et cetera. And then we'll discuss a treatment plan, how much weight you're should be losing weekly, you're weighing weekly from home, um, and get you going. Send prescription to the pharmacy of choice. And I see patients all over the state of Texas. So if you or a loved one is interested and you reside in the state of Texas, then I'd love to help you lose weight. I also do vitamin B12 therapy. I offer B12 in either single doses, multiple doses, or in unscheduled doses. And you may ask, well, how do I know if I'm possibly could be low B12? So there's a variety of symptoms, things like, issues with vision or vision changes, forgetfulness, mood swings, depressive like symptoms, numbness and tingling, feeling tired, hair loss. I also offer steroid joint injections. These injections go directly into the joint. I inject shoulders, knees, hands, and feet. And I do offer the Medicaid. I do, with the injections, I do provide the medications as well. I ask a variety of questions to make sure that these particular injections would be of benefit for you. And then we set up an appointment and get you injected. I also offer follow-ups and go from there. If you're particularly feeling under the weather with sore throat, runny nose, stuffy nose, congestion, earache, cough, fever, etc., then I can offer antibiotic injections or antibiotic prescriptions, antiviral prescriptions, antifungal prescriptions, etc. If you suffer from other illnesses like depression, anxiety, thyroid related issue, again, high blood pressure, you're looking at quit smoking, um, high blood pressure, etc., message me. Even if you're unsure if I offer the service, ask and I'm happy to refer you if I don't um, offer the service. But that's essentially it, guys. If you have no questions or you have no suggestions for topics for next week, then no worries. I will be suggesting topics for. I'll have topics available. I have a topic available for next week. I'll be on here for a little bit longer in case somebody has a topic that they want to suggest for next week. If not, no worries. Like I said, I will offer. I'll create the topic for next week. But if not, I want to thank you for joining me on your Wednesday evening. Our goal is to continue to increase the public and the awareness of my show. So if you have friends, family, or loved ones that are interested in learning more about a variety of medical topics, please spread the word about my shows. I'd love to have an increased gathering of followers. For those who have been faithful from day one, thank you. I appreciate you. And like I said, If you're interested in a free tens machine, I'd love to provide that to you as a token of appreciation for following my show. Alrighty, guys. Well, I'm not seeing any comments. I'm not seeing any questions. So I think that's all for tonight. I'll see you guys for next week. Thank you and have a good night. Until next week. Thank you. Bye bye.